Some studies estimate that 178 million Americans are missing at least one tooth, and up to 40 million are missing all their teeth. Now, if you're one of those people and you are missing teeth, and you're wondering what we can do about that, then this video is perfect for you. Missing teeth can be restored with either fixed or removable options, and the one we pick really depends on the number of teeth you're missing. In this video, we'll go through different situations, different scenarios, and we'll talk about the kinds of treatment that can be used to address that particular problem. If you are missing a single tooth, that is one of the simplest problems in dentistry to fix nowadays. Way back in the past, before the arrival of dental implants or bridges, the only option was really to do a flipper, a removable partial which replaces that single missing tooth. This is a valid option, however, it is a lot more uncomfortable and is a lot more cumbersome to use, mainly because of the fact that it's removable, it requires more maintenance and more hygiene, and it doesn't feel anything like a natural tooth. Going further in time, the next step up was to use a fixed bridge. In this situation, the two neighboring teeth were cut down and prepared for crowns. After that, a bridge is made to replace all three teeth. The downside to doing fixed bridges, however, is that now we are condemning the two neighboring healthy teeth to being prepared unnecessarily. In this case, all three teeth are splintered together and their fates are now sealed. If one of them were to fail in the future, the entire restoration will be lost. As technology advanced, the next step up from that was to do an adhesive bridge. In this situation, instead of preparing the teeth and cutting them down into cones, we are able to use materials to adhere to the back of the neighboring teeth. This way, we can be a lot more conservative and save as much tooth structure as we can. The downside to using adhesive bridges, of course, is that like any adhesive, there is a risk of them falling off at any point in time. If this is a concern, then something more permanent might be a better option for you. Over 40 years ago now, dental implants were discovered. They have been an absolute game changer in terms of restoring missing teeth. A single missing tooth can now be restored very predictably with a dental implant. However, this is provided that there is a good amount of bone support where the tooth used to be. Over time, after an extraction, the bone begins to remodel and it begins to shrink away. If this happens over a number of years, sometimes it makes the situation impossible to place an implant. So if you are missing a single tooth, see a prosthodontist as soon as you can and learn your options as to what can be used to replace that missing tooth. Now, if you are missing more than one tooth, the situation becomes a little bit more complex. Traditionally, that has been addressed by using removable partial dentures. Same as flippers, these are removable prostheses. They can be made with a metal base so they fit a lot better, but ultimately, it's still a piece of plastic in your mouth that tries to simulate what you've lost. The next step up, of course, is to use dental implants. Now, implants are anchored in the bone, so a single implant is able to support more than one missing tooth. For example, if you're missing 3 or 4 teeth, we don't need to place 3 or 4 implants to replace the whole lot. Sometimes we can get by just placing 2 implants. Because they are anchored solidly in the bone, they can be used to support all the missing teeth in a fixed bridge. Now the next step up, of course, is if you're missing all your teeth in one or both arches. Conventionally, regular dentures can be made to replace the teeth. Dentures have been around in dentistry for a very long time, so we are very familiar with how they're being used. They are good for aesthetics, they can replace all that you're missing, but it does take a lot of work to be able to use them for speech and eventually for function. One of the problems with dentures is that the amount of bite force that you can put on a denture is going to be way lower than what you can for natural teeth. If regular teeth were to stay at 100%, the bite force of a denture is only going to be anywhere from 20 to 40%. One of the other problems with a denture is that it's removable and sometimes it moves around a lot when people are talking. This is particularly the case for lower dentures because, unlike in the upper, there is no palate to give us a nice suction. Instead, there is the tongue, a big muscle that can move around and dislodge the denture very easily. So, a step up from regular dentures would be to use implants to help to hold the dentures in place. These are technically called implant retained overdentures, and it uses the principles that implants can be fitted with different kinds of components. In this situation, implants can be fitted with a locator attachment, and that attachment can be used to hold the denture in place, kind of like a snap-on design. Implant overdentures are great if you just want to hold the denture in place. However, They don't help as much if your concern is that you want to be able to eat comfortably with them. If your concern is convenience, however, implant overdentures are very much quite like regular dentures. They have to be removed to be cleaned. Some patients do like this because it is a lot more convenient for them and they find it easier to take care of. However, there are a number of patients who prefer their teeth to stay permanently fixed and they don't ever want to have to remove them. If this is a concern for you, the next step up would be to use the implants to support a fixed bridge instead. This can be done in a number of ways. The traditional all-on-4 design requires the removal of a good amount of bone in order for us to restore all the missing structures. Fixed implant bridges can also be used if we want to replace just the teeth alone. Either way, implants are now able to support an entire arch of teeth just by placing anywhere from 4 to 6 implants. So, whether you're missing a single tooth, a few teeth, or even all your teeth, dental implants can help you. Come and see us for a complimentary consultation, and we're able to give you your options and explain to you the pros and cons of each before you make your decision.